Ladies and gentlemen, thank you for standing by and welcome to the COVID-19 Media Briefing Conference Call. At this time, all participants are in a listen-only mode. After the speaker's presentation, there will be a question and answer session. To ask a question during the session, you will need to press star 1 on your telephone. Please be advised that today's call is being recorded. If you require any further assistance, please press star 0. Thank you. I would now like to hand the conference over to your speaker today, Mr. Mike Schomer. The floor is yours.
Thank you for joining us for the COVID-19 media call for October 19th. We'll start today with comments from Health Commissioner Jan Malcolm and MDH Infectious Disease Director Kris Ehresmann. Following that, we'll hear questions from reporters on the line. With that, I'll now turn it over to Commissioner Malcolm.
Thank you, Mike, and good afternoon, everyone. Around the world this morning, we are now over 40 million cases and over 1.1 million deaths. And in the United States, we are now over 8.1 million cases and 219,000 deaths. Here in Minnesota, we have a new total of 127,439 cases. 1,632 cases were identified on Sunday, reporting today, on a testing volume of 22,171. This is now our 10th consecutive day of over 1,000 cases. Today's case report follows over 3,400 new cases reported over the weekend as well. On Saturday, we reported 1,704 cases from Friday. Sunday, 1,732 cases from Saturday. 1,616 of the cases we are announcing today were confirmed or PCR positive cases, and only 16 of the cases were considered probable cases or antigen positive. We have a new total of 2,239 deaths in Minnesota. This is up 5 from the day prior. Saturday, we also added 5 deaths, and Sunday, 17 deaths. 5 of the deaths we're reporting today were among confirmed or PCR positive cases, and none were among probable or antigen positive cases. 4 of these deaths occurred in residents of long-term care facilities, 1 death each in Aiken, Mille Lacs, Ramsey, Redwood, and Stearns counties. This total includes 1 person in their 90s, 2 in their 80s, and 2 in their 60s. There have been a total now of 8,916 patients in the hospital since we started tracking the pandemic. 2,414 total people have received intensive care. 469 people are in the hospital today, 137 of them in ICU. The weekly change in our cases is up 9.6%. That compares to an 8.4% weekly growth a week ago today. Now, this weekly change was higher at the end of July, but it's been heading steadily up in recent weeks. I'll note that the addition of the antigen testing results is not of a high enough volume at this point to change the weekly change percentage. The weekly change in testing is up 7.8% from the week prior, and this compares to a weekly rate of change of 8% a week ago. So it's important to note, and as I mentioned, I think last week, this is a big change that for the first time now we are seeing faster growth in cases than in testing. So despite our really pretty impressively high testing numbers, we're still not able to catch all the disease that is out there. That case growth is faster than testing growth. We see that too in the test positivity rate, which is now 5.8%. Up from 4.9% a week prior. And recall that these positivity rates are as of a week ago. So we don't count the last week's data in these calculations because those data change for about a week with case corrections and so forth. So this testing positivity rate over 5%, as we have indicated, is a red flag for us of concern that the rate of viral presence is still very high and growing, as we can see from the test positivity rate increasing. Before handing it over to Kris, I just want to note that she's going to be talking about National Infection Control Week And I just want to note that one important part of helping to control infection, in particular COVID-19 infection in Minnesota, is testing. And we will be opening additional new testing locations, opening up the state saliva lab, and highlighting other important developments related to testing. And we'll be having more to say on that in the next few days. And with that, I will pass it over to Kris Ehresmann.
Thank you, Commissioner. I want to acknowledge that October 18th through 24th is International Infection Prevention Week, and MDH wants to acknowledge the hardworking infection preventionists who are keeping our communities safe. Infection prevention and control has always been an important part of health and safety, but this year's COVID-19 pandemic has brought about extraordinary challenges. Infection preventionists collaborate with each other and their professional organization, APIC, the Association for Professionals in Infection Control, and epidemiology to meet the organizational needs to keep patients, residents, healthcare providers, and the public safe. So infection preventionists keep up with the latest guidance, develop and implement policies, and support their coworkers. Please recognize these important healthcare professionals for their tireless efforts in performing this important work. So we celebrate you as we acknowledge the Week of Infection Preventionists. And then I just wanted to comment on safe voting guidance. With just 2 weeks to go until Election Day on November 3rd, we wanted to take a few minutes to share some information to help people who may be wondering what they can do to minimize their COVID risk while voting. First, we want to strongly encourage people to get out and vote so their voices are heard. Second, we know that election officials at the state and local level have been working really hard to make things as safe as possible at voting locations. We thank them for their work up to this point and for all they will do in the weeks to come. Third, it's important to know that you have many options for how to vote, from in-person on November 3rd to early in-person voting or ballot drop-off boxes. Obviously, voting alternatives that limit the number of people you come in contact with or the amount of time you are in contact with others can help reduce the spread of COVID-19. Voting by mail or dropping off your ballot are the safest methods, but to put in-person voting in context, we generally say the risk of voting in person is comparable to going to the grocery store. Not zero risk, but in a managed environment, the risk is limited. It's good to be prepared ahead of time. The Minnesota Secretary of State has links to all county election office websites. You can check your local election office for the methods to vote available in your area, what you may need to bring, or additional voting information for people with disabilities. We have safe voting guidance on our website, and we won't go into all that detail on the call. But one tip we can share is that it's a good idea to take steps to avoid crowds if voting on Election Day. So to avoid crowds, you may want to vote at off-peak times, such as mid-morning. Stay at least 6 feet away from others. Wear a mask. Wash or sanitize your hands before entering and after leaving the polling location. While in the polling location, use alcohol-based hand sanitizer, especially after touching surfaces frequently touched by multiple people, such as door handles or voting machines. Cover coughs and sneezes with a tissue or the inside of your elbow. Wash your hands or use hand sanitizer. And of course, stay home if you're sick. And for more information, please check out our safe voting guidance online at health.state.mn.us/diseases/coronavirus/voting. And with that, I'll turn it back over to Mike Schomer.
Thanks, Kris. Operator, we're ready to take questions.
As a reminder, to ask a question, you will need to press *1 on your telephone. Again, that is *1 on your telephone keypad. To withdraw your question, press the # key. Your first question comes from the line of Glenn Howard from Star Tribune. Your line is open.
Hi. Given the rise we've been seeing in cases recently, I wanted to ask you about your public health messaging. Do you think you're reaching the people you need to reach to change behaviors, and are you considering making any changes to the messages you're giving out?
Well, this is Commissioner Malcolm. I'll start and certainly invite Kris to comment as well. I think it's a great question, and I think public health communication is always something we want to get better at. We've been really trying to drive home the same basic messages for a long time now, and it does seem to us that people might be tuning out some of the messaging. We certainly are wanting people to understand that it's not only their perception of personal risk that matters, but the way that our individual choices affect other people and create chains of transmission that we will never directly see, but may very well be influenced by. So I think as we look to continuing to get these messages out, I think we're very interested in finding partners, messengers that will perhaps have more relevance to some of our audiences, be that younger people or people in different segments of the population. So finding community partners to help make sure that these messages aren't just coming from voices in government that they may have heard a lot from over these last months will be important to us.
And this isn't related, but there is some news today. Republicans in the House and Senate had a press conference at 1:30, and I imagine you probably didn't hear it, but they gave a message that they've been giving for a long time, and that is that schools should be open, churches shouldn't have restrictions, youth sports, bars and restaurants, basically lifting a lot of the guidelines. If that were to come to pass, what impact do you think that would have on cases and deaths?
Well, Commissioner Malcolm, again, I'll start and invite Kris to chime in here. Just based on what we know about where the transmission is happening, really all places where people gather increases the risk for transmission. So it would be a time, given where we are in the pandemic and the rate of case growth that we've seen, especially in the last few weeks, we would not recommend further increasing gatherings of people. And so we think, we've got some calculations that show if the cases continue to grow at this rate or if the rate of growth accelerates, what would be likely to see in hospitalizations and deaths. And the answer is one leads to the other with a couple of weeks or several weeks lag time, as we have seen. We are seeing hospitalizations increase. We are seeing, unfortunately, the mortality rates increase. Last week, we had more than half of the days where our number of Minnesotans that we lost was in double digits. We haven't seen that for a while. So all of these indicators are going in the wrong direction, which to us does not indicate that it's time to relax our cautions.
Yeah, I'll add to that and just say that I think, our concern is that not only are we concerned about the cases in any particular individual or any particular sector, but we did talk about how on the call Friday, how cases in the community are having an impact on our healthcare staff. And so that has a ripple effect to long-term care, to acute care. So we want to be looking at kind of all the implications of our increased case growth, not just what it means for the individuals who are sick and hospitalized, but the impact it has on other sectors to be successful and to be able to, particularly for healthcare, to be able to take care of all of us going forward.
Thank you.
Your next question comes from the line of Catherine Richard from Minnesota Public Radio. Your line is now open.
Hi. I was listening to the call last Friday, though I was not on it, and I heard the representative from HCMC talk about how they had to kind of shut down ICU beds because of staff shortages. And I'm trying to get a sense of how widespread that may have been across the state so far. Are you seeing that happen more often right now? And are these, if that is the case, are these ICU beds, intended for COVID patients or just patients who would be in the ICU no matter what?
Well, it's an important point. I mean, and I think Kris just kind of referenced this too, when we look at hospital capacity, it isn't just capacity for COVID patients, it's capacity for other serious illnesses, car accidents, heart attacks, strokes, the whole range of things that we depend upon this hospital capacity to be available for. And I think the comment that the Hennepin Healthcare CEO made on Friday was really speaking to ICU use in general, not that the ICU beds that were impacted by their staffing shortage. And I think she said that it happened a couple of times. And so that's the example we heard about on Friday. I know that other health systems, other hospitals have also had to juggle bed capacity because of staffing shortages with the rate of increases in cases from among healthcare workers that we've seen. But it's not just COVID care that they're taking offline, if you will. It's really affecting the whole continuum of capability that they have, which is again why we urge people to understand that the ripple effects of more COVID case growth, as Kris explained a minute ago.
And I'll just add that if just for some data points in terms of the hospitals being very full, and so it's not only the bed as you've talked about, but it's also the availability for staffing. But both ICU and non-ICU occupancy in the metro area hospitals has been above 90% for most of October. Statewide, it's between 80 and 90%, and it's typical for hospitals to be full, but obviously we want to be monitoring that, and that is happening, but we want to be sure that we're not contributing to challenges because community spread is impacting healthcare workers. And then just as a point of detail, in terms of the role that COVID plays in, bed use, in September, COVID hospitalizations represented 9% of ICU bed use and 3% of non-ICU bed use. And in October, that has grown, so it's 13% of ICU bed use and 5% of non-ICU bed use. Thank you.
Okay. And just to follow up, it's snowing outside where I am right now just a little bit, which is a reminder of the fact that we are moving into this holiday season. And I guess I'm just wondering if you guys have any advice for people as they try to navigate the next few months. What should people be considering around getting together for Thanksgiving or not? And what are the attributes of safe activities in the winter as opposed to some of the stuff that we've been doing throughout the summer?
Well, I'm going to start, and then I am going to ask Kris to comment on this as well from a risk mitigation standpoint. But this is part of why we've been expressing such concern about our high level of case growth, really, throughout September and into October. That we're going deeper into the fall and into the holiday season at a far higher level of cases than we had hoped, because we know what comes next with colder temperatures, with people going more indoors, with the strong desires and traditions to gather for celebrations and holidays. And this is, I'm going to quote our colleague Mike Osterholm, who's been saying this a lot in the press, including nationally, that this is not a typical year, and our strongest advice to people would be to take many, many more precautions about holiday gatherings than they typically do. It's a really good time to consider not having the same kind of family gatherings that you would have had in the past. Hopefully this is the year of this massive disruption will not continue on, deep into next year. But for now, we're in a very high-risk environment. So avoiding some of those traditional gatherings around the holidays, painful as that will be, is going to be the more prudent course. But Kris, do you want to speak a little bit to risk reduction if people are doing gatherings?
Sure. Yeah, I think it's important that as we're talking about this, that we're putting in the context of reducing risk rather than eliminating risk, because any activity that you're undertaking, aside from being completely isolated, does have risk associated with it. So as we're talking about things to consider, it is from the standpoint of reducing risk, not eliminating it. I think the things that you want to be thinking about are, making sure that if you're getting together, that gathering size is small. So if you're used to having multiple extended families come together for a wonderful potluck on Thanksgiving where you see everyone from across the state and catch up, this is probably not the time to do that. You probably want to think about a much more limited gathering. So groups of 10 or less would be an important consideration. The other thing that you might want to think about is if you're gathering with people outside your immediate household, that even though it's going to be too cold over Thanksgiving to be outside, that when you're inside, that you consider social distancing, that you think about how can we interact, but interact 6 feet apart. And maybe we will be wearing masks, not what we would normally consider doing. And if we were outside, we may not need to, but because we're indoors, because it's outside of our family, we would consider masking. So I think you want to think about those things as you're considering if and how you would be celebrating these upcoming holidays. But I think the really important thing is that this guidance does not mean that doing this is safe or that there's no risk. It simply is helping you get some ideas of how you could reduce the risk of getting together.
Okay, thank you.
Next question comes from the line of Joe Mavon from 5 Eyewitness News. You may ask your question.
Hi, thanks for taking the call. We're doing a story today about hair salons and barber shops seeing a decrease in business after the boom in business that happened right after the order was lifted back in June. And I just wanted to see, have you guys heard of any salons or barber shops where you've heard of cases or an outbreak that is surrounding a hair salon or barber shop?
Kris, can you take that one?
Yep. Yes, we have identified 4 situations in hair salons or barber shops that involve customers and staff. So 4 out of the many outbreaks that we've seen, and we don't need to obviously release names because these individuals have all the names of all their customers, and so they've been able to do notifications. But yes, we have had 4 situations in which we had evidence of both the staff and the customers having COVID.
And that's 4 cases across the entire state then, or is that just the metro are we talking about?
No, that's across the entire state.
Okay. Thank you.
Yep.
Next question is from Kate Redditz from WCCO Television. Your line is open.
Thank you. Today in Wisconsin, and earlier this month in Minnesota, it feels like some of the restrictions or the limitations for restaurants loosened a little bit here in Minnesota, but today a judge in Wisconsin upheld the governor's order to have restaurant capacity at 25%. Do you think if our cases continue to go up, could we see some of that dialing back? Restaurants are going into a tough season with winter. I mean, is it possible some of those restrictions could get tighter?
This is Commissioner Malcolm. I think it is always possible, and I think the governor has been clear about that since the beginning, that while the desire is certainly to see things open up and businesses and people able to enjoy some of the things that we all enjoy, that's all in the context of, does the virus really allow it? And I think as we just keep reinforcing, if folks are following the current guidance, the current capacity limits, the social distancing, the mask wearing, that we do believe that the current guidelines, if followed, would help to limit the rate of spread. Just a clarification on what was announced last week really did not increase restaurant capacity, but it did create more seating flexibility within the restaurant. So just a point of clarification there. But certainly our preference would be that folks just follow the guidance, take precautions, and that would certainly help us to avoid having to dial back further. But as the governor has often said, he'll keep all those options on the table as needed.
And then unrelated, but I know tomorrow you're opening a new saliva testing site in Brooklyn Park, and there will also be some new ones coming out later this month. Do you think that will help? You said that this is the first time that the case growth is outpacing the amount of testing. Do you think that could help if you're able to identify cases sooner with the more tests that will be available?
Absolutely, we do. It's been a goal to really increase testing. We've had some great success there, but we know that there are still communities, places, individual people having still long waits for testing results or having a hard time getting the tests when they need them. So anything we can do to increase testing supply, and also, as we've talked about before, having different types of tests available, the nasal swab PCR tests, the saliva-based PCR tests, some of the rapid tests that are in development now and on the market now, that having a variety of tests, as long as we can help people to access the right kinds of tests for the right purposes, and making that widely available with faster turnaround time, all of that is to the good if it helps us identify cases sooner. But I will also say, just having the test results is only part of the story. Folks really then need to act accordingly. We need people to get tested when they're feeling sick. We need people who have been told that they are contacts of people who've tested positive, to follow the quarantine guidance and watch their own health and get tested if they develop symptoms. So people need to act on the results of the test. That may sound obvious, but it's just again part of the story. Just the test by itself isn't enough. People need to act on the recommendations that come along with the test results.
Thank you.
Next question is from John Croman from KARE 11. You may ask your question.
Hello, can you hear me all right?
Yep. Yes, we can.
Hello. It's been a while since I've been on one of these calls, so forgive me if you've answered this question a million times, but we're still hearing from political candidates kind of a narrative that the state caused caused most of the deaths in long-term care settings by transferring recovering COVID patients to nursing homes. Could you just kind of sum up your current theory on that and whether or not there's anything to that?
I'm going to ask Kris to comment on specific case data that we have here in Minnesota, but I'll just remind listeners that we have made tremendous progress in Minnesota at improving infection control. The providers in long-term care settings have worked really hard, as have we in public health, to increase protections for workers and residents in these long-term care facilities. And we now, I think, are ranked 39 out of 50 states in terms of our number of cases that occur in long-term care settings on a per population basis. And our ranking is also quite good on deaths per population in long-term care as well. So tremendous progress has been made. We've expressed concern in recent days and weeks that cases in long-term care are going up again as a result of the same phenomenon, that workers in long-term care are getting exposed to COVID out in the community, not at work, but in the community, and then unknowingly bringing the infection into the long-term care facilities. But in terms of the more specific question you asked about transfers from hospitals to long-term care, Kris, can you, I know you had updated on data about that earlier on. I don't know if you have an update.
Yes, I mean, we have looked at this at multiple points across the pandemic so far, and that is just patently not true. When we what we did was we looked at our case numbers and compared situations in which a resident case was the first case in a facility, which eliminated a lot of cases because obviously if staff were the first, it wasn't because of a resident being transferred in. And then we looked at, were those cases, had they been hospitalized, had they come back to the facility? And we were able to, on several different occasions, go back and look at every single situation. And I believe there was only one situation in which we couldn't identify, had this person potentially, been in the hospital and returned to the facility. But no, that is not an accurate reflection of what has happened in our facilities. We definitely, as the commissioner said, we definitely saw spread in the spring, but that spread came in through staff, and we've really worked with facilities on making sure that they have access to PPE, and that we've worked with them on infection prevention and all of those things. So, that kind of narrative is actually not held up with the data.
Well, I appreciate you going through that again. The other real quick question I'd have is we're seeing a lot of advertising on TV for face shields, and they're even recommending them for restaurants. And basically, it rests on the server's neck and kind of covers their mouth and nose, but there's an opening between their foreheads and the shield. So it's like stuff could get out from their nose area. It could travel upward and you go around. Their ears aren't covered. It's just kind of it's kind of a cough shield for the most part. Is that something that you think is fine in restaurant settings in Minnesota?
Kris, would you comment?
Yeah, that is something that does not have some of the characteristics that the masking requirement asks for, and so it's as you described, it sort of blocks or puts up a slight barrier, but it's not covering the mouth and nose. So if you think about someone breathing, obviously droplets or aerosol could go up the top. Obviously it's better than nothing, but it would not have the same protective effect that a cloth mask would, that would be covering the nose and mouth. So I'm sure that for people that are, working hard in a restaurant setting, that may be, considered more desirable because it gives a little bit more airflow. But the very fact that it gives more airflow means that it's not going to provide the protection that we need to see, both for the server themselves as well as for patrons. So, that's why we've recommended the cloth masks.
Thank you very much.
Next question comes from the line of Mohammed Kali from Somali American Radio. Your line is now open.
Thank you very much, the Commissioner and Kris. Thank you for updating every day. This is a lot helpful for East African, especially Somali community. Every day we go through after then we go to the radio and we update them all the how many people got case, how many cases we got, how many new cases, how many hospitals. Can you share with us more about detail about East African community, especially Somali community? How many people is died and how many people is getting this? Can you get those more detail?
Mohammed, we certainly can get you that detail. I don't know, Kris, if you have that right at your fingertips or whether we can provide that offline.
Yeah, I'm just looking, and Mohammed, we have data. I am able to break down, for instance, the new cases for today by race, and so I can tell you, the number of individuals who identified themselves as Black, but I don't have the ethnicity as being Somali at this point. So that would be something that we would have to pull for you. We could get that for you, however.
I hope we can get that, because I remember last year we have a missile broke down. 87 Somali children got missile, and we get that information, and we should get how many people is getting COVID and how many people died in our community is very important, because that's the question all the people they asking us when we broadcasting for the number increasing in Minnesota. And also, I just want to say the last question: did you have a message in different language? So we want to make sure people get their own language, because a lot of people don't speak no English, and everything is getting tough. So we have to provide their own language. And did you have some East African expertise? We can call them. We can help us to educate our community.
Yes, we actually have a number of staff who are East African, and we also have messages that have been translated. So we will connect with you and get you both the messages that are like print posters and things that can go in print media, as well as messages that have been translated and that are available in Somali.
Thank you. And the last question I want to say, the call is coming out right now. So a lot of people will be confused COVID and call, and how can we prepare for this kind of, it's already started. How can we do we have a plan for how to protect the call and COVID and all those tough times we're going through? That's the last question. Thank you.
Well, I think certainly those issues about the fact that we've got a lot of COVID circulating in our communities, and we're going into a tougher part of the year in terms of people being more indoors. Just again means that it's all the more important to really adhere to all that prevention guidance about staying at home when you're sick, limiting the gatherings that you have with other people outside of your household, keeping 6 feet apart, wearing masks. That it doesn't matter if you're just seeing, extended family members or friends. That's not inherently safer than just interacting with strangers out in the community. So it's just really important that we redouble our efforts to do everything we each can to help limit the spread. So some of those, again, that messaging about, holidays, community celebrations, cultural practices. It's, to your point, it's very important that each part of our community has information that's really relevant to them. So I hope you'll find the material that we've developed in partnership with Somali organizations to be helpful.
Operator, we have time for one more question.
Our last question is a follow-up question from Catherine Richard from Minnesota Public Radio. Your line is now open.
Hi again. So I was just checking out the dashboard here, and 3 out of the 5 dial back measures are in this caution zone and heading directly upward. I feel like you guys get this question a fair amount. I know on Twitter today I'm having some people write me to say, please ask this. So I will ask it again. I mean, if you have 3 out of 5 dial back measures in the caution range and they're all going up, like at what point do you decide to dial back? What would it take at this point to dial back those measures, given they're all headed in the wrong direction?
Well, I think we do have kind of the caution thresholds and then higher risk thresholds. We're always learning from the experience of other states about so that the measures themselves are getting updated and more precise. Certainly, all of these risk measures are important to track and to track together. So it is sort of how do things come together? What's the context of the numbers going up? But there's no question that our level of concern is increasing, and that we are really trying to dig deep into all the data that Kris and her team have about what's driving the transmission and what kinds of changes might help to slow down the rate of growth. And even though it's repetitive, what we're seeing is the transmission is everywhere, and it's not just kind of 1 or 2 sources. It's not one or two kinds of settings. It's these individual decisions that we're all making that is adding up to fueling the rate of increase that we're seeing, which is why the message really is a very broad one to the whole community, that we all need to take this seriously, and it's not just a matter of restricting specific settings, but those things will continue to be evaluated. But we really just need everybody to understand that the risk situation is higher for those individual decisions that we're all making day to day.
Yeah, and this is Kris. I'll just add to that the commissioner and I had an opportunity to be on a call-in today, and heard from some vocal members of the public who really just are not at the same place we are in terms of concern about the pandemic, and expressing that people aren't wearing masks in their community. They're really not adhering to the guidance. And so I think one thing that, as the commissioner just said, it's really all of our individual decisions. And we know that there are many people who are very concerned and taking things seriously, but we also recognize that there are some individuals for whom this just doesn't seem to be a big concern. And I guess one thing that I worry about is that when we talk about dialing back, we're talking about decisions that will impact our economy. And I know that's something that the governor thinks about, and technically I shouldn't even be thinking about it at all because I'm just the scientist on the team. But when we talk about some of those things, it really pains me, because I think there's lots of things we could do collectively that would make a huge impact that would come before those kinds of decisions. And so when I hear, from the public that they're not at the same place that we are in terms of concern, I think, if we would just all kind of come to a middle point about taking this seriously, that would have a huge impact on making a difference and might not be as punitive for the economy. But as I said, technically that's not my role. My role is just a public health one. But and so with that role, I'll just remind you, please mask and social distance and avoid large crowds.
Kris, I just want to make sure I'm clear on what you're saying. I think what I heard you say is that you would, to shut down the economy again, close all bars and restaurants, whatever that means, would be almost a step too far, because what would really be most effective is for people to be on the same page about how we're dealing with this pandemic, everyone wearing masks, everyone not having parties. I mean, I just want to make sure I'm understanding you correctly.
Yeah, I mean, I think what I'd say is that it's not that shutting everything down couldn't have an impact, but the unintended consequences of those kinds of things are really great. And so if we could start by just getting on the same page with masking and social distancing, I think that would really go a long way in making a big impact on the transmission that we're seeing before we think about those really more serious considerations that obviously have to be thought about.
And not to be too cynical, but has the ship sailed on that at this point?
Well, we sure hope not. I think, we appreciate the fact that, what's happened in the last couple of weeks has, certainly getting a lot more media attention. Hopefully it's getting more public attention. That to the extent we might have gotten a little complacent in recent months, we're in a different situation now. And so we are hoping that people will give this another look and think about, the individual decisions that we're all making, and just understand. And this, again, we hear this in the reports we get each week from the White House Task Force too. And heard this from Dr. Birx, not only when she was here in Minnesota, but on some of her national calls, that what seems to have changed more recently is the decisions that we're making to kind of let down our guard in more private settings, that we're not seeing as many problems in the public settings. It's the parties, it's the birthday parties, the weddings, the celebrations, the gatherings, going out with friends. That if people would take the precautionary measures as seriously in their private interactions as they do in their public interactions, that's really not just a message in Minnesota. That's really kind of a nationwide, campaign we need to be on the same page about as well.
Okay, thank you for taking all my questions.
That's all the time we have this afternoon. We do invite any reporters with additional questions to reach out to our communications office. Have a good day, and we will be back with you again on Wednesday. 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 Wednesday.